Today's talk was focusing on Astrazeneca's vision strategy for collaborating on developing better treatments in the cardiovascular, renal and metabolic space. So I started the presentation by introducing the audience to Astrazeneca as a company that understands that an integrated approach to investigate and invent and innovate new medicines for the future will have to incorporate the strategy that incorporates both cardiovascular, renal and metabolic phenotypes of patients. So in AstraZeneca we call this strategy the Care Me strategy, and particularly I highlighted one of our recent ongoing major efforts in this area. This is the dapagliflozin program. It's called DAPA-CARE, where we investigate a lot of patients both in type 2 diabetics, in renal patients or patients with reduced renal function, and also in patients with heart failure, to see if these new class of SGLT2 inhibitors can actually have disease-modifying effects in these populations. Then I went on to explain a little bit about the way we discover new targets, how we develop our new medicines. We have a large initiative to sequence many genomes from patients to understand if there are any new targets that can be discovered and that can be developed into drug targets. That is one of our next goals that is ongoing. And then I went on also to explain about how we internally work really in a great effort to make sure that we find the right target, we find the right safety, we find the right patient, and we find the way to improve healthcare in the future. And finally, I highlighted also one of AstraZeneca's really important goals, namely to increase collaboration with experts. We need to focus on science. It's a strong science-based company. We want to collaborate with those who have the best science, who can help us develop new medications and that can deliver some great new ways of looking at how we can improve patient lives. So this can be done by direct collaboration in terms of consortia. It can be done in ways of collaborating through grants or in-kind contributions, or we also have a so-called innovation hub where we can actually take startups, we can take small companies in, and they can have incubator space with AstraZeneca in sort of to lean on all the resources that we have in-house, and we can access through that, or they can access through that, the database of several 100,000 compounds that could be potentially repurposed for new areas or in already explored areas for further development. So that is another important strategy of ours to collaborate with the external world.